Good morning from Miami Beach. This is Dr. John Bennett, broadcasting another Neurosurgery Super Sunday with Iype Cherian. And we have a good turnout today. Let's go around and meet the panel before we turn it over to Iype. Let's start with Mo. Hello, Mo. Can you please tell us where you're from? And go ahead, Mo.
Hello, everyone. Hello, everyone. I am Dr. Sunya Mo, a fourth-year neurosurgical resident from Myanmar.
Yeah, welcome, Mo.
Nice to meet you all.
Thank you. Ibrahim.
Hello, Dr. Iype. Hello, everyone. It's Ibrahim, medical student and PhD student from Berlin, Germany.
Okay, welcome. Michael, welcome.
I'm Mike Sugar. I'm a neurosurgeon from Sydney, Australia.
I think he's met you, Iype.
Not in real life, but on here a couple times.
Oh, okay. Okay, yeah. Mike spends a lot of time in China. Zolo, could you please introduce yourself?
Hello, I am Zolo, a senior medical student from Buea in Cameroon.
Welcome, Zolo.
Thank you.
Dr. Shiv, could you please introduce yourself? Go ahead, Dr. Shiv. Well, he may have stepped away. And the other neurosurgeon from Delhi, New Delhi. Go ahead.
Hi, I'm Dr. Mrigang from Delhi. I'm a second-year neurosurgery resident.
Second year, sir. What city?
New Delhi, sir.
Oh, I'm sorry, New Delhi. Okay, Manuel. Go ahead, Manuel.
Hello, everyone. My name is Manuel. I am from Dominican Republic, resident of second year of neurosurgery here in Moscow.
At the Burdenko Institute.
Yes, sir. Burdenko Institute. Hi, Professor Iype. How are you?
Good to see you. Good to see you, Manuel.
Burdenko is a big name. Marco, could you please introduce yourself? Go ahead. Whoop, your microphone there, Mike. Go ahead.
Hello, everybody. Hello, Iype. Nice to see you again. My name is Marco Meloni. I'm a consultant neurosurgeon in North Italy, Gravedona city.
And a frequent participant. Welcome, Marco. Okay, I think we introduced everyone. Okay, Iype, it's all yours, and welcome. And thank you.
Okay, guys, before I share the screen today, I'll go ahead and tell you a few concepts that if you have enough experience, how to go from the level that you are in right now to the next level. Okay, this is something from my personal experience. So I'm going to share it. There are different views of how to go ahead. There are many people who has experience. There are people who do different things. There are people who do things differently. Both has a difference, I'll tell you. Now, you know, all of us, after the first, we get the neurosurgical degree, and after that, we practice for about 3 or 4 years. And then we come to a point where we don't know where we are actually improving. Where we really do not know whether we are progressing or not. And this can happen many times, even after 10 to 15 years, whether we compare our results and say, hey, I clipped this aneurysm 5 years back and the results were not so different. So what am I doing in the last 10 years? Where's my experience taking me? So a few things for the middle level consultants. I mean, so I don't know whether the medical students and the residents would benefit from it, but then this is a very important knowledge that you should have when you hit a point where you think you're not really improving. Okay, this is something I'm going to tell you. So number one, okay, point number one, most important point, ergonomics. Okay, now there are people who sit and operate under the microscope as if, you know, they are literally doing a circus act. So when I see a surgeon, when I see one of my boys or my assistants sitting down and operating or standing up and operating, I tell them, see, listen, you're not comfortable under the microscope. You sit under that microscope as if you're going to have a tea on a Saturday afternoon. Okay? You're sitting for a tea on a Saturday afternoon. Don't sit as if you're sitting in a suicide act in some circus. So if you are sitting very strained with your head off to one side and you're looking up like that and you're operating, you will not be able to sustain that for a long time. If your hands are not rested properly, you will have tremor. If your hands are not in the right distance, you will have tremor. If you have not rested enough, or for example, if you dissected an aneurysm and you go take off, stretch yourself, look at the image once, and then come back and sit down and then do the aneurysm. This is my perspective. I have seen a lot of people, like for example, Dr. Yuha or Dr. Atul Goyal, for example. These are people who go through a procedure with a uni-focus mind. I mean, I've seen them doing that. And they don't care what position they are in. If the world is upside down or the world is, in whatever shape, you are in whatever shape, they don't realize it. They just operate, finish, come on. Okay? But I feel that for me, I'm a lazy guy. So I like everything. I like to sit down. I like to put my hands properly. And then I like to, relax completely. I make sure that my hands are completely rested. Only then I go into the pitch of the surgery. I go into full-fledged surgery. Okay. So this is point number 1, ergonomics. Remember that. Okay. Point number 2 is magnification. This is something that you may be missing out on. Most surgeons are comfortable to see everything in one frame. So you must see the optic nerve, you must see the carotid, you must see some brain, you must see the sylvian also. It's comfortable. Okay. But believe me, if you want to go to the next level, all you have to do sometime, step up on your microscope. If your microscope doesn't allow you to go past 25, go past to get a 3-step magnification changer or a magnify. There is something called a magnify, or there is this ProMag attachment for Zeiss. Get it, increase your magnification. Okay, especially when you are doing arachnoid dissection, magnify. There is no question that it will improve your skills. It will be very tough because you will lose your bearings completely. Okay, so that is why I would advise you first time go back, orient yourself, then magnify. Before you do something, magnify. It will also help you to be on the center of your field. Okay, try this. So the second point to get into the next level, magnify. Okay, number 3. Step number 3. Clarity of field. This is something that I find novice neurosurgeons to real advanced neurosurgeons. You do an aneurysm, the whole place will be full of blood. Everything is, and the low magnification, you're trying to put a clip. It'll never work. It'll work for sure. It'll work, but it won't be beautiful. It won't be elegant. Okay, it won't be like Rahul Dravid, patching off a square drive. It'll be somebody like our English Jason Roy trying to, hit something. You don't know what he hit. He doesn't know what he hit. The ball goes to a boundary. Well, that's a boundary, but God knows what he intended, right? So it's like an inside edge, all right? So this is the thing. So be clear. So how can one be clear on the field? Number 1, lot of water. Okay. Sometimes I say to my boys, my consultants or the fellows that I have, neurosurgery is an underwater surgery. Okay, put in a lot of water, clear out all the blood, try to reduce your bipolaring. Okay, try to reduce as much as your bipolaring. Even if something is bleeding, no problem. Put water, put constant irrigation. That way you're going to be, your field is going to be clear, your arachnoid is going to be clear. And if your arachnoid is clear, your surgery is going to be beautiful. Okay, so lot of water. All right, clear field. So I have put forward some points right now. I'm going to discuss it with you. I mean, I'm putting these points as short as possible because today there's an India-England match going on and I don't want to miss a lot of it. But remember all these points. Okay. Fourth point. Okay. One of the most important points. See the pathology beforehand and have a clear idea of it on scans. I've seen a lot of neurosurgeons going into the operation room, asking them, oh, what do we have today? And they say it's an aneurysm. Oh, okay, it's an aneurysm. Let's do it. That looks very cool, but it's not very cool, by the way, unless you are a genius. Okay, I mean, we're not geniuses, so I'd like to see my picture very clearly. I'd like to know what kind of an aneurysm it is. And I'd like to know where I can dissect without any fear. Where I'd like to, I mean, sometimes you get it wrong, but most of the time you get it right. If it's a tumor, where do you think this nerve is going to be? Where do you think? You should have an idea at least. For that, you must see the scans. Is there any cystic area on this tumor? Where are the vessels feeding this tumor coming from? What trajectory should I take? All this is going to be coming from your preoperative planning. And if you're not doing it right, you're always going to be one step behind. So to take your surgery to the next level, preoperative planning is really important. Next point, organize your stuff and make it very clear to the sisters. You know, there's this story about a fox and a cat. So once the fox asked the cat, hey, if the lion comes right now, what are you going to do? So the cat said, I'll just climb a tree. Okay. So the fox laughed at the cat and he said, you know, I have thousands of ways. I can play dead. Okay. I can do ventriloquism so that the lion will believe that I'm somewhere else. And at that precise moment, the lion came. And what happened? The cat just climbed the tree and watched the fun as the fox was trying to do all this fun. And, you know, in the end, the lion walked away with the fox. So don't have 100 things. There's no need to have 100 things in your armory. Okay. You should know what knife you're going to use. You should know what kind of drill are you going to use. You should know what dissector are you going to use. And your scrub sister also should know very clearly what is this guy going to use. So there's no confusion. And most neurosurgery can be done with this. A certain dissector, for example, I'm a big fan of diamond knife. So I like the diamond knife so much. Okay, I like certain dissectors. For example, the small ball dissectors. I like it very much to dissect around the aneurysm. I like it very much. So you should know your stuff, and you should have an assistant who knows your stuff as well. Okay, maybe a sister, maybe an assistant, maybe a consultant, maybe a resident. Okay, they should know, and you should have a clear understanding as to when you're going into critical areas, you develop aphasia. You know, that is, I develop it. So I just point my hand, and if I don't get something, then not only aphasia, I go crazy. Okay, I don't like it when I point my hand. Usually, there is somebody who understands me very, very clearly and hands it over to me. Sometimes she hands it over to me, the wrong thing, but it is probably better than the thing that I wanted in the first place. All right. So this is the person that you need to have in the theater. All right. This is the person that you need to have in the theater. Very, very important. Okay. So these few points, how to take your surgery to the next level. Last thing but not least, patience, balls. Okay, courage. Sorry, patience and courage. Patience. Supposing you don't have one hand and you have only one hand, you can still do beautiful neurosurgery. Believe me, trust me. I can maybe for some cadaver dissections, I can demonstrate this to you that if you have only one hand, have an assistant, have patience, and believe in yourself. You can do every single dissection. Okay. If you have two hands, fantastic. Supposing you have a tremor like this, even then you can do excellent surgery. If you know your force, if you have patience and courage. Why patience? Because you don't want to rush through certain things. Why courage? Because you know this tumor is bleeding. You have the courage not to pull it out before it should be taken out. Okay. Before it's time, don't pull it out. That is when disasters happen. Don't try to clip an aneurysm before it is actually meant to be clipped. So patience and courage is in one bracket. I'll keep it in one bracket. Okay. So patience to make sure that, you know, you peel each layer by layer. You take the tumor arachnoid. It'll be bleeding like hell. Who cares? Okay. Bleeding is the tumor's property. Taking it out is your property. You have to win, not the tumor. Right? And if you end up impatient, again, a simile to cricket, what's the difference between professional teams and amateurish teams? The amateurish teams, they try to go hell for leather. They try to hit everything out of the park without any reason or rhyme. So they survive in a 2020, but not in a 50-over match or in a test match. They cannot compete with a very professional team who will go very slow, very composed, and to a plan. They play to a plan. Even if somebody is hitting them for 6 sixes in an over, they're not going to panic. They're going to relax, take it easy, and that is exactly what you need in surgery. Okay. So with all these points, so somebody is asking me how not to hurry or rush. That's exactly what I told you. Have courage and self-belief that you can take out this tumor. One of my greatest lessons came from one of the neurosurgeons that I found in Kerala. This guy is not even using a microscope. So I was taking out a large tumor and the carotid was just next. So I was very, very edgy. It was 10 years back. So I was taking it very edgy and I was leaving a huge chunk of tumor. He said, what are you worried about? I said, the carotid. He said, it's 3 millimeters, 3.8 millimeters to 4 millimeters. What are you worried about? I mean, of course, without a microscope, it's just 4 millimeters. So, I mean, you really don't have to worry about the carotid. Okay, you really don't have to, but doesn't mean that you don't respect it. Okay, there is a difference between worry and respect. So you have to go into a state where you can be working really close to the carotid. I mean, all my fellows who've been with me, they will understand, they have seen me doing this, that we dissect out the entire aneurysms. We don't put temporary clips. We go all around the aneurysm, show everything to the fellows, then only go clip it. Okay. If it ruptures, we're not going to jump up and down and worry. We're going to just clip it off, right? So these are the points I would like to tell you to take your surgery to the next level. Next time we can show you some videos as an example, some disasters, some dissections we can show you. So thank you very much. Okay, God bless.
Okay, very good, Iype. Thank you very much for opening up right away to all the panelists. There's a couple of panelists we haven't seen yet. Hello, Dr. Capullo. You're muted there, Dr. Capullo.
Yes, Dr. Bennett, can you hear me?
Yes, we can hear you now. Could you please introduce yourself? And if you want to say any remarks, go ahead.
Thank you. My name is Kabulo from Congo. I'm a final year neurosurgery resident at the University of Zimbabwe.
You're welcome. Sunil, could you briefly introduce yourself before we turn it over for discussion?
Hello, sir. My name is
Hello.
Sunil. I'm from China. I'm doing my residency in neurosurgery.
Okay, welcome, Sunil. And there's one more person that we have a lot of people here today. Sugar, oh yeah, a friend, a fellow of yours. Hello, Sugar.
Hello, John. Hello, Professor. It's really nice to see you all.
Welcome, welcome. And you did a month in Bharatnagar, correct?
More than a month, John. I
3
was
months.
almost 4 months.
Oh, okay, great, great. Welcome. Joffrey, another South American. Hello, Joffrey.
Good morning. Thank you for the conference. I'm Jeffrey Portilla, a neurosurgeon in Cuenca, Ecuador. Thank you.
And Quentin, what a view of the mountains and back. Okay, okay, very good. It's open. And Samar, hello, Samar, could you please introduce yourself?
Hello, everybody.
Yeah, hi. Where you from, where you work and stuff?
I'm Samar Hoz. I'm from Iraq. Actually, very nice presentation from Professor Iype. And I totally agree for the last pieces of wisdom that he gave about the patients. And just to mention in one of my fellowship, the surgeon.
What's going on there? What's going on? Okay, go ahead. Go ahead, Samar. Let me see what's going on here. Okay, okay, go ahead. I don't know, we're getting that feedback from.
Okay.
I can't tell, I'm sorry. Okay, any comments or questions from the other panelists?
Hello, John. Hello,
Go ahead,
everyone.
Naru, how you doing?
I'm fine. Hello, Professor Iype. I hope you are doing well. Nice to meet you again today, and your great presentation. And I am totally agree with all you said about your advice. And thank you very much. Obviously, we know that you have to go in step by step and have a curve line in our practice, like senior resident, like specialist, associate professor. We have to know that in neurosurgery, you have to learn with curve line. So thank you very much.
Thank you for your feedback, Naru. Okay, more comments or questions from the panelists?
Yeah, John.
Go ahead, Marco.
First of all, I want to thank Iype for your precious peers. I recognize myself in some of the things you told, like, for example, the bleeding when a tumor, you perform a tumor. When I want to just tell one of my experience, personally, what I do with my young doctor, young neurosurgeon, the training and the use of some instrument like a microscope or like drill. I attempt to use this instrument and I suggest use the instrument even in some surgery that could be sometimes trivial. For example, when you have I have a chronic subdural hematoma, I suggest, because it's the same route I walked in the past, to use not the perforator, but the drill. Because I tell my young doctor, use the drill to perform the hole so you can feel the touch of drill. You learn to use the drill and you see if you're able to do the hole without eating the dura mater downside. It's a good exercise, I think. So use this instrument. Don't have fear to tell your nurse to take it out the drill. But it's just a chronic subdural hematoma. You just need hope. Okay, but I want to use the drill to train myself, to feel the touch of the drill and educate my hands. So that's it.
Anybody else? Any comments or any questions, please? Thank you, Marco.
Thank you too, Iype, and thank you everybody.
Good morning, Professor.
Okay. Go ahead. Go ahead.
All right. I wish to know if, for example, the surgeon has tremors. How can he do to control it? For example, if he gets often he has tremors. What is there any trick to use or any tip you can give for him to better control these tremors?
You mean in per procedure if
Hello, Manish.
neurosurgeon have tremor?
Yes, like he's stressed up. He's stressed up. Yeah. Obviously, they will say the person has to calm down, but he's really calm, but he keeps on. Yes, he keeps on having these tremors.
Oh, I will let my senior answer you before I will tell you about something.
Iype, did you hear his comment?
Hello? Do you hear? Do you hear me?
Yeah, I'm getting you.
Yeah, Iype, are you there?
Second, Manish, I am in the middle of internet conference where I'm talking. I'll call you in 10 minutes.
Okay, I think.
John, sorry for that. I had to take a call. So tell me, what is the question, John?
Okay, could you repeat the comment, Zolo?
Yes, all right. So personally, when I'm stressed up, I usually like I'm having tremors when I'm stressed up. So I don't know if it happens maybe during a surgery, what is a tip? Is there a tip that you can give to control them? It essentially comes when I'm stressed up. So yes, obviously they're going to ask me to relax, but it's not easy to relax when maybe there is an aneurysm that just got ruptured and you're seeing blood everywhere. It's not easy to relax. So is there any particular tip you can give to better control that?
I can't hear anything what you say. There's a lot of echo, so I probably cannot hear anything.
Oh, go ahead, everyone. Maybe you can repeat it. Go ahead.
Can you hear me, Professor Iype? Can you hear me?
Yes, I can hear it. I can hear you.
Okay. Zolo wants to know how he has to manage or to deal with tremor when he in per procedure he has tremor because he going on stress, and he wants to know how he can deal with this stress and stop the tremor about. So I will let you answer him. And
number one, your hands has to rest every 5 to 10 minutes. This is very important. If you are drilling or if you are doing a deep dissection, make sure at the end of 5 minutes you rest for at least 1 minute. Okay, take rest, look at the field, irrigate, relax. Okay, so that is rule number one. So every 5 minutes, ask your assistant, who is your trusted assistant, like your scrub nurse. She might just tell you maybe you should take rest. Okay, that's it. Because we want to keep continuing. So you take rest. Okay, that is the easiest technique. Second thing, make sure your shoulder is rested, your elbow is rested, your wrist is rested. Okay, 3 joints has to be rested. So how do you rest? You have a if your chair has a handrest, your shoulder and elbow can be rested. At the tip, you can either rest your hands on the handrest, on the Mayfield or Sugita, or you can rest it on the patient's head. So if your hand is not rested, elbow is not rested, shoulder is not rested, you will have tremor. No question. Okay. So these are the few things that you can help to avoid the tremor. Another thing is, as you grow more and more in confidence, and to grow more and more in confidence, you have to do more and more cases, experience. Okay. Once you have experience, your tremor will come down. But confidence, it comes from the fact that, you must understand that you're trying your best. Okay. You're just trying your best. However good you are, there are certain things you cannot handle. So that is beyond what you can handle. So forget it. What you can handle it properly. Okay. If an aneurysm bleeds where before you've dissected it, I also have problems. Okay. The best aneurysm surgeon in the world also will have problems. Okay. Everybody will have problems. So everybody can run into problems. So, but the best thing is to understand what you are doing is the best that you're doing. So when you have a lot of panic and worry whether you are doing it, can you do it and all that, then what's going to happen is you end up doing much less than what you should be doing. Okay. So you take that off, again your tremor will come down. And learn breathing. Okay, this is a Indian thing about yoga. I always, my fellow Sugar and where is Manuel, Sugar, everybody who came here, I have told them how to do breathing. It's like shooting. When you shoot, you breathe. Or if you do archery, it is on your breathing. Surgery is also like that. Learn to do breathing. Breathe in, breathe out with your movements, and coordinate with your movements, your tremor will be much less. Thank you very much.
All right. Thank you very much, Professor. Thank you.
I have one
Professor,
comment.
Go ahead, Naru.
One thing that I can.
Oh, I'm sorry.
Okay, go,
Go
Naru.
ahead.
Okay, one thing that I want to add at the Professor Iype comment, it's really, really, really useful, the training in yoga. Like he pointed before, we have practiced some, and that helps you a lot. Other thing that I have learned during these 4 months in Nepal is that the training is really important. Training in microvascular during the sutures with the chicken wing, with the microscope daily, will help you to increase how you control the tremor. Because sometimes you will get upset about don't doing properly or don't do it as fast as you want, and that will teach you how to control yourself. In an empty room, use yourself. Have to breathe. I prefer sometimes put some music and try to just, like the professor said, breathe and start again. And then you will see, even in the chicken wing, how well you will perform when you are calm. Using sometimes, like the doctor says, some medicines, some beta blockers, I think we are not meant to that. With proper training, with proper breathing, you should be able to accomplish that. Other thing that I have learned during my time in Nepal, because with professor, we also go to the gym after hours. And it's really, really helpful when you build up your strength in your shoulder and your arms. So in that way, you can stand in one or another positions more properly for longer, okay? I know that sometimes we don't have much time to do this kind of stuff, but I think that for ourselves that we are kind of young, it's really, really important. I have heard a lot of neurosurgeons said that, no, you should not train with weight, you should not do weightlifting, because that will decrease your skills, and that is not true. I have proved myself during my time in Nepal. We were working out, and then a couple of days later, doing microsurgery, and actually helps me to stand more still. So, like Professor Cherian said, Zulu, maybe breathing and practice. Practice under the microscope, practice every day, and we will see your skills will improve. And in the breathing is really, really important in the OT also.
All right. Thank you very much, Doctor. Thank you. Thank you.
Thank you all. And I have just one comment for Zolo.
Go ahead.
You know, neurosurgery, it is more exciting. And so if it is, sometimes it will not be your choice, you will have adrenaline. So know that you have to keep calm and breathe. And before you start your surgery, have in your mind how you will do done planning, and know that what I can be fight or against when I will operate my patient. What is the complication I have to avoid, and if I have this complication, how I have to manage that. You have to have all this planification in your head, and when you start your surgery, when you will see some things who can make you stress, you have to know that yes, I know that maybe I have to fight against this complication. So what I have to do, you have to be more give more concentration about that, and don't think about anything, because you know that it is possible to have that. So don't stress, keep calm and breathe. And sometimes you can take 1 minute or 2 minutes to breathe, to keep calm and continue your procedure. I remember one thing, so when I was my second year of residency, I received one patient like that, depressed skull fracture of about sinus sagittal superior. I will never forget this case. And when I done I remove the bone to decompress, what I see, I am fighting, bleeding about sinus sagittal superior, and that is bleeding so, the debit is so high. But I know before I start this surgery, I know that I will have this problem. So I keep calm. My anesthetist start to stress. Oh, tachycardia. I say, please let me down my job. I keep calm. And in 5 minutes, I stop bleeding. I done canalization. I stop this bleeding. I do all I have, because when I start, I prepare my suture to suspend the dura, the lateral part of sinus. I prepare myself about of that, and when I have that, I take up and done my suspension, put Galea, and try to put Surgicel, Cotonoid, and done hemostat, and perform canalization of my sinus, and bleeding stop, and patient come back to stabilization in 5 minutes. But if I was stressed, I don't manage my stress, maybe I will lose my patient on table. So always we have to know that surgery, we can have complication per procedure or post-operator. So we have to be ready to deal with all that. So we can avoid always stress, but we have to deal with this stress and think about how we can manage the complication and how to manage our stress. And thank you for all your comments, Sugar and Professor Iype. I am totally agree with what you said. Thank you, Dr. Marco. I am very agree with all you said, and it is important to know and to manage our stress in pre-procedure.
All right, thank you very much. Thank you for all your contributions. I'm grateful. Thank you.
You are welcome.
Hello, Vinod. Are you there? Are you there, Vinod?
Yes, I'm here. Hi, John.
Hello, say hi to Iype.
Hi.
Hello.
Ryan, say hi.
Today I don't feel adrenaline here today. Today it is so lowly. I don't know. There is this webinar, we don't have adrenaline today. What happened? It is
okay, any more comments or
so
questions on what Iype said? furniture. Oh, I think we have a comment from a child in the audience. Vanad. Hello, Vanad. Well, I have a comment. I'm not a neurosurgeon, but you know, some tennis players, to get used to the feel of their racket, they walk around with it all day long. Do neurosurgeons do that at all? Is that kind of a crazy thought where they walk around, they get so used to the feel of an instrument, they carry it around? I mean, to really get to know the feel. Is that something that's done, Iype, or is that kind of a...
This is with me all the time. This is my micro scissors. So what I do is, it is like an extra, I can do anything with it, okay? And whenever I get the time, I go do this, keep doing this, okay? This is right now, right with me in my office. So this is the instrument that I use maximum to dissect, or, you know, to cut, to retract a bit, to see what is happening. So this is and the bayonet also has a tip like that. The needle holder, the micro needle holder also has a tip like that. Handle like that. So this movement is something that I have to keep doing. So I advise you guys to, you know, make sure these instruments are an extensions of your hands. You know, neurosurgery is a very, very difficult surgery. So average people, you know, it's difficult for them to do neurosurgery. So the only way if we are average and we want to do good neurosurgery, is to put every single, you know, your focus into improving your surgery. Good point, John. Thank you.
Okay. Thank you, Iype. Okay. Dr. Gabullo, any comments for Iype? Hello, Dr. Gabullo.
Yes.
Yeah, any comments for Iype or what he had to say? Do you walk around with the instruments in your hands, Dr. Gabullo? Do you get used to the feel of an instrument so it's part of your hand? Maybe. Okay, I think we had some problems there with, I think we lost.
Yes, Dr. John.
Oh, there you go. There you go. It's cool.
I said I don't have a comment since I joined late. Thank you so much,
No
Professor
problem.
Iype,
Yeah,
for
thanks
this
for
good
coming.
presentation.
Thanks for coming, Dr. Gabullo. Okay. Any more closing comments or questions? You know, I have another question. What kind of, or actually, Manuel, what kind of exercise, do you do any specific shoulder exercises like push-ups, lifting weights? What specifically do you use to strengthen your shoulders? Or do you do anything aiming at strengthening your shoulders?
Well, no, I generally don't do just strengthening of my shoulders. I go, when I go to the gym, I kickbox for about 20 minutes. And after that, I go on and work on different routines. For example, I work on my abs for 10 minutes. And after that, two major muscle groups, either the legs or the shoulders or the chest or the back. So I don't just strengthen my shoulders. So I keep rotation of everything. We have a trainer. So this guy keeps letting us do it.
Mm-hmm. Okay.
Mm.
You
Can I add one
recommend
thing?
Marshall? Well, go ahead, Marco. Go ahead.
Oh, no, I will just say my experience. Personally, I do, because in my department we perform a lot of spine surgery. This is a very hard, keep your, at the heart prove your force. So I need to perform a heavy exercise, something like that. Anyway, my personal experience is to not only exercise but also diet. What you eat is very important. You cannot have a strong dinner with alcohol, many calories, and the morning after perform a surgery. You feel bad. So my suggestion is to have a good diet, a lot of fruit, vegetable, more water. So not only water into the operative field, but also into your body.
Okay, very good. Okay, we'll let you enjoy the rest of the day with your family. Thank you very much for a great presentation, and thanks for taking the time more than anything. And thanks all the panelists for coming. So
Thank
we're
you,
gonna.
John. Thank you, Iype. Thank you all. Nice Sunday, everybody.
Yeah, you're
Thank
welcome.
you all.
Okay, we'll wrap this up and we'll stay here. So thank you very much.